Hey everyone, welcome back. Today we're taking a deep dive into some research on, well, this is interesting, red light therapy.
Oh, yeah.
And it's
Yeah.
about how it could maybe help kids with myopia,
Myopia. Yeah.
which I know a lot of you are dealing with. So, as always, we'll try to break down what the science says and what it all means.
Absolutely. And, myopia is, like you said, it's becoming more and more common.
Yeah,
And it can actually lead to some pretty serious eye problems later on if it's not managed well. So, we have treatments out there, but they're not perfect. Some have side effects, some don't work for everyone. So,
yeah. So is that where this red light therapy comes in? Is this like the new hope, the bright idea that we've
the
all been waiting for? Well, I guess that's what we're here to find out, right?
Exactly. We
Yeah.
can't get ahead of ourselves, but this study, it looks promising. It's a meta-analysis, which means it combines data from a bunch of different studies on the topic.
You're
So
right.
we're not just looking at one little piece of the puzzle.
Right. More like looking through a magnifying glass to get.
Yeah. A much clearer picture of the whole thing. And what's really interesting about this particular meta-analysis is it looks at studies that followed kids for up to 2 years, which is
Oh,
pretty long for this kind of research.
yeah, for sure.
Yeah.
Okay, so let's dive in. First of all, who are they looking at in this meta-analysis?
Okay, so they pulled data from a lot of kids, like over 1,600 kids
Wow.
between the ages of like 6 and 16. So a pretty wide range there.
Okay, that's a good sample size.
Yeah.
And what exactly was the treatment they were testing? I mean, what does this red light therapy actually involve?
So basically, the kids wore these special glasses
Right.
that emitted low-level red light, and they only wore them for a few minutes, like 3 minutes.
Oh, that's not bad.
Yeah, twice a day, with at least 4 hours between sessions.
Okay. So pretty manageable, it sounds like.
Yeah, much less invasive than, some other treatments out there.
Right, right. So that's the what of the treatment. But the big question is, did it actually work?
Right. So to figure that out, they focused on two main things. One was axial length, which is basically how long the eyeball is.
Okay.
And then the other was spherical equivalent refraction, which is, kind of a fancy way of saying how blurry someone's vision is without correction.
Okay. So they were trying to see if this red light therapy could, like, slow down how fast myopia was getting worse.
Exactly.
I thought myopia was all about the shape of the lens in your eye, not the length of the eyeball.
Well, the lens does play a role for sure, but with myopia, what actually happens is the eyeball itself gets longer,
Oh, okay.
and that's what causes the light to focus in front of the retina
Oh, I see.
instead of right on it, which is what makes things look blurry.
So that's why they were measuring axial length.
Right. They wanted to see if the red light could keep those eyeballs from stretching out too much.
Gotcha. So what'd they find? Did it work?
Well, when they compared the kids who got the red light therapy along with their regular glasses to the kids who just wore their regular glasses, the ones who got the red light therapy, their myopia didn't get worse as quickly.
Oh, wow.
Yeah, both in terms of the axial length and that spherical equivalent refraction.
Oh, that's amazing. So it's like the red light therapy was, I don't know, like hitting the brakes on the myopia, slowing it down.
That's a great way to put it. And this wasn't just a temporary thing. The studies tracked these kids over time.
Okay.
And the ones who were getting the red light therapy, their eyes seemed to stay more stable, like the stretching kind of stopped. Whereas the control group, their myopia kept progressing.
Wow. So that's really promising. I mean, it sounds like it could make a real difference for these kids. But did they say anything about like how long these kids would have to keep doing the red light therapy to keep seeing those benefits?
That's the million-dollar question. Some of the studies followed the kids for up to 2 years, like I mentioned.
Yeah.
But we still need more research, longer-term studies, to really understand what happens after the therapy stops.
Like, do the benefits last or does it start getting worse again?
Exactly.
Yeah, yeah. That makes sense. Well, it definitely sounds like we need more research to figure all that out.
Yeah, for sure.
But this is definitely a good sign.
Yeah.
This is encouraging.
Very encouraging. And, there's a lot more to unpack here. So many interesting things we've learned from this research, but we'll save that for part two.
Yeah, we don't want to overload everyone all at once.
Right.
So we'll be back with more on this red light therapy research soon. But until then, thanks for joining us for this deep dive.
Absolutely. And thanks for sending in this research. We love exploring these topics with you.
Yeah, we do. All right, see you next time.
See you then. One of the studies in this meta-analysis, actually, it found a rebound effect after the red light therapy was stopped.
Oh, so like their myopia started getting worse again, like all those good results just vanished.
Well, not necessarily completely vanish, but yeah, their myopia did start progressing again at a faster rate.
Oh, okay. So like taking your foot off the brake, the car starts rolling downhill again.
Yeah, that's a good analogy. It definitely makes you wonder if, maybe kids would need to keep doing the red light therapy forever to keep those benefits.
Right, right. Hmm. Well, I guess that's something else they'll have to look into with more research, right?
Exactly. And to be fair, other myopia treatments can have a rebound effect too, like atropine drops. When they're stopped, sometimes you see the same thing. So researchers are still, trying to figure out that optimal treatment duration, like how long do you need to do it to get those lasting results.
Yeah, yeah. Makes sense. So besides the need for those longer term studies, are there any other gaps in the research so far?
Well, one thing that kind of jumped out at me was that all the studies in this meta-analysis, they were all done in China. Yeah. And while it's great that the findings were consistent across all those studies,
Right.
we really do need to see similar research in other parts of the world, in more diverse populations, before we can say for sure that it'll work for everyone.
Yeah, that makes sense. Different groups of people might respond differently to the treatment.
Exactly. And even within those Chinese studies, there's still more to learn. Like they looked at different power levels for the red light devices,
Hmm.
but we still don't know for sure what the optimal power level is.
So it's not just a matter of like the more red light, the better.
Right, exactly. It's more complicated than that. There might be a sweet spot,
Okay.
but we need more research to figure out exactly what that is.
Right. Okay. So finding that perfect prescription for red light therapy is still a work in progress.
Yeah. It really highlights how important it is to work with an eye care professional.
Right.
Someone who really understands this technology and can tailor the treatment to each individual kid.
Yeah, for sure. It's not one size fits all.
Nope, definitely not.
Okay. Now I'm curious about the how behind all of this.
Yep.
Like how does shining red light into a kid's eyes actually help with myopia? What's going on there?
That is a great question, and honestly, scientists are still figuring that out. But one of the leading theories has to do with these things called mitochondria.
Mitochondria. Oh, aren't those like the powerhouses of the cells?
Yeah,
The energy factories?
exactly. The tiny batteries that keep everything running.
Okay.
And there's some evidence that red light, it might actually stimulate those mitochondria in the eye,
Okay.
like boost their activity. And that could, in turn, help support healthy eye development
Interesting.
and maybe even slow down that elongation of the eyeball.
Oh, okay. Wow. I mean, that's pretty mind-blowing. Just light,
Oh, it's amazing.
having that kind of effect on the eye.
It really is. It just shows you how interconnected everything is in the body and how powerful light can be.
Yeah. Speaking of interconnectedness, I noticed this research also talked about something called choroidal thickness.
Ah, yes.
And I'm not really sure what that is or why it matters.
Okay, well, the choroid, it's this layer of tissue at the back of the eye.
Okay.
And it's really important for nourishing the retina. The retina is that light-sensitive part of the eye that sends signals to your brain.
Right. So it's like the support system for the retina.
Exactly. It keeps it healthy and functioning. And what's interesting is that, studies have found a link between choroidal thickness and how fast myopia progresses.
Really?
Yeah, it seems like people with thinner choroids, they might be more likely to develop myopia.
Oh, so that's like a warning sign almost.
Yeah, you could say that. A thicker choroid is generally a good sign, especially when we're talking about myopia.
Okay. So where does red light therapy fit into all of this?
Well, some studies suggest that red light therapy might actually increase choroidal thickness. Yeah. Remember how we were talking about that temporary thickening they saw in the control group of one study?
Mm-hmm.
Well, some researchers think that red light therapy might be able to do something similar,
Okay.
but in a more sustained way, like a more lasting benefit.
So it's not just slowing down the symptoms of myopia, it's maybe actually addressing one of the underlying causes.
That's one of the really exciting possibilities.
Wow.
And if that turns out to be true, it could really change the game for myopia management.
Yeah.
Maybe even help us prevent it in the first place.
Wow, that would be huge. This is really eye-opening research, pun intended.
Aha! I like it.
But before we get too carried away with all the potential benefits, I know you always like to make sure we're looking at all sides of the story. Are there any potential downsides to slowing down myopia progression? Anything we should be aware of?
That's a really good point. And, it's important to remember that anytime we're talking about about medical interventions. There are always going to be nuances. Right.
And myopia, while it's definitely something we want to manage effectively, some researchers have actually suggested that in its milder forms, it might actually have some evolutionary advantages.
Wait, really? How could being nearsighted be an advantage? I always thought it was just, a pain.
Well, think about it. In our modern world, we spend so much time focusing on things up close, right?
Yeah.
Like screens, books, detailed work. And if your eyes are slightly nearsighted, it might actually make those tasks easier.
Oh, so it's like our eyes are trying to adapt to our lifestyles, kind of.
Exactly. And, some researchers think that if we slow down myopia progression too aggressively, we might actually be interfering with that natural adaptation process.
That's interesting. It's like we don't want to mess with nature too much.
Right, exactly. It's all about finding that balance,
Right.
managing the risks of high myopia, but also allowing for some degree of natural adaptation.
Okay, so it's a delicate balance. Like we
Yeah.
don't want to throw the baby out with the bathwater. Right.
We need to look at the bigger picture
Absolutely.
and think about the long-term implications of what we're doing.
I completely agree. It's about making informed decisions, based on the best evidence we have, but also acknowledging that there's still a lot we don't know.
Yeah. Okay, so to kind of sum up what we've learned so far, red light therapy, it seems like it really could be a promising way to manage childhood myopia. And it might even be able to address one of the underlying causes by increasing that choroidal thickness. But of course, we still need more research, especially in diverse populations and longer-term studies to really know for sure how effective and how safe it is in the long run. And we need to be mindful of, maybe messing with that natural adaptation of our eyes to our modern world.
That was a fantastic summary. You really hit all the key points.
Well, I had a great teacher.
Well, there are a couple more interesting details from the study that I wanted to point out before we wrap up. I don't know if you have time to go over them.
Oh, yeah, absolutely. I'm all ears.
Okay, great. So remember how we were talking about how important it was that this meta-analysis included studies with those longer follow-up periods?
Mm-hmm.
Well, one of the key findings from the study with the 24-month follow-up was that there was that rebound effect after the red light therapy was stopped.
Rebound effect. You mean like their myopia started getting worse again?
Yeah, unfortunately.
Oh, so it seems like those positive effects, they weren't permanent in all cases.
Right.
Well, is that common with other myopia treatments too?
Yeah, it can be. Like atropine drops, sometimes you see a rebound effect with those as well when they're stopped. It's definitely one of the challenges in managing myopia.
Yeah, I bet. So, I mean, does this mean kids would have to keep using red light therapy like forever to keep those benefits?
That's one possibility. But researchers are still trying to figure out, that magic number. How long does the treatment need to go on for to achieve those really long-lasting results?
All right. I guess it's another question for those long-term studies to answer.
Exactly. And speaking of long-term effects, another fascinating thing they found was that there seemed to be a relationship between the power level of the red light device and how well the treatment worked.
Oh, interesting. So stronger light equals better results.
Well, not necessarily. It was a little more nuanced than that. The study that looked at different power levels specifically, it actually found that the highest power wasn't always the most effective.
Oh, wow.
Yeah.
That's interesting. So it's like there's a sweet spot, like you said earlier.
Yeah, it seems like there might be.
Not too strong, not too weak, just right.
Exactly.
Okay. So really, it sounds like we're still in the early stages of figuring out how to use this red light therapy effectively.
Yeah, we are. But the progress is really remarkable.
It is.
Yeah.
Now, before we move on, I just want to clarify something for our listeners. We've been talking a lot about this specific meta-analysis, but are there other studies out there looking at red light therapy for myopia?
Oh, absolutely. Yeah. This meta-analysis was a great overview of what we know so far.
Right.
But there are definitely, individual studies being done as well. And some of those are looking at slightly different things, like different wavelengths of light,
Okay.
different treatment durations, and even combining red light therapy with other myopia treatments.
Wow, so much research going on.
There is. And that's what's so great about science, right?
Yeah.
It's always evolving.
Yeah, which means we'll probably have even more to talk about in future deep dives. Right?
Oh, I'm sure of it.
Okay. Now, I had one more question about the study that I wanted to ask before we wrap up. This one's This one's a little more technical, but I was hoping you could shed some light on it, pun intended.
Uh-huh. I appreciate the pun. Okay, ask away.
Okay, so I noticed the study mentioned something called axial elongation, and
Hmm.
I wasn't really sure what that meant or why it's important when we're talking about myopia.
Right. Axial elongation.
Yeah.
So that's really a key part of how myopia develops.
Okay.
You mentioned earlier that myopia is basically the eyeball getting longer.
Right.
Well, axial elongation, that's what that is. It's that stretching out of the eyeball along its length, its axis.
Okay, so it's literally the eye getting longer.
Exactly. And usually the more the eye elongates, the worse the myopia gets.
Oh, okay.
So a big part of managing myopia is trying to prevent or slow down that axial elongation.
Right. That makes sense. But how does that even happen? What causes the eyeball to stretch out like that in the first place?
Well, it's complicated. We don't fully understand all the mechanisms involved,
Right.
but it seems like it's a combination of genes, your genetics and environmental factors.
Right.
Genetics definitely play a role. If your parents are nearsighted, you're more likely to be nearsighted yourself.
Right. Right.
But our lifestyles these days also seem to be contributing to the problem, to more and more people becoming nearsighted.
What do you mean by lifestyles?
Well, we spend a lot more time indoors than than people used to.
Yeah.
Right. And a lot of that time, we're doing things that require us to focus up close.
Right.
Reading, using computers, staring at our phones.
Right. Right.
And all that near focus, combined with less time spent outdoors, less exposure to natural sunlight, it seems like that might be disrupting the normal signals that control how our eyes grow.
Oh, okay.
And leading to that excessive axial elongation.
So it's not just what we're looking at, it's also how much time we're spending outside.
Yeah, it seems like both of those things are important.
Interesting.
There have actually been studies showing that kids who spend more time outdoors, they have a lower risk of developing myopia. Yeah, and researchers think it's because, sunlight, it's much brighter than most indoor lighting.
Right.
And it has a wider spectrum of light, and those things seem to help regulate eye growth and prevent that excessive elongation.
Wow. That's amazing. So getting kids off the screens and out into the sunshine could be like one of the best things we can do for their eye health.
Absolutely. I mean, that's a message we should all be hearing, right? Get outside more.
Yeah.
Not just kids, but adults too.
Yeah, for sure. It's such a simple message, but so important.
It is.
Okay. So back to red light therapy. Is there any evidence that it can directly affect that axial elongation process?
Yes, and that's part of what makes this research so exciting. We talked about how red light might be able to stimulate those mitochondria in the eye. Well, some researchers think that mitochondrial stimulation, that could be part of how it helps regulate eye growth
Okay.
and potentially reduce that axial elongation.
So in a way, it's almost like red light therapy is mimicking some of the benefits of natural sunlight exposure.
That's one possible explanation, and it's definitely an area where more research is needed.
Yeah, for sure.
But it's a fascinating idea, right?
It is.
That we might be able to harness the power of light, both natural and artificial, to help manage myopia.
Yeah. It really shows you how important it is to understand how light in our eyes and our overall health are all connected.
I completely agree.
And it makes you realize like how much more there is to learn about how light can be used to improve our lives.
Absolutely. And that's what makes this kind of research so intriguing.
Yeah. Well, this deep dive has been so illuminating, pun intended again.
Well, I'm glad you're enjoying it.
I feel like I've learned so much about myopia, about red light therapy, and just about the importance of both natural and artificial light for keeping our eyes healthy.
Me too. And that's what makes these deep dives so rewarding. It's all about exploring these topics together and giving you, the listener, the knowledge you need to make informed decisions about your own health and the health of your family.
Exactly. Now, before we wrap up, I know you always like to leave our listeners with something to think about. So what's the thought-provoking question or statement you have for them today?
That's a good one. Let me think. Okay, what if we took what we know about the benefits of spending time outdoors?
Okay.
And went a step further. Like, what if we actually designed our indoor environments to better support healthy eye development?
Oh, wow. That's interesting. So you're talking about more than just, taking breaks from screens, right?
Right, exactly. It's about rethinking the way we light our homes, our schools, our workplaces.
Huh.
What if we could create indoor spaces that more closely mimic the light conditions that we find in nature?
That's a really cool idea. I mean, it's almost futuristic, but I can see how that could be really beneficial.
Mm. Right. Imagine classrooms that are bathed in full spectrum light. Or offices with windows that let in tons of natural light, or even just homes that are lit with lamps that provide a wider spectrum of light than typical artificial lighting.
Right, right. I mean, it would be a big change, right? Like we'd have to completely rethink the way we think about lighting.
Yeah, it would require a real paradigm shift.
But the potential benefits could be huge.
They could. And it's not just about preventing myopia. Exposure to the full spectrum of light, including blue light, which we often hear bad things about, but blue light from the sun.
Right.
That's actually really important for regulating our circadian rhythms, our sleep-wake cycles.
Okay.
And it can even improve our mood and just make us feel better overall.
Wow. So light really is super powerful.
It is. And we're only just beginning to understand all the ways it affects us.
Yeah. So to our listeners out there, I encourage you to take this information and run with it. Talk to your eye care professional about red light therapy. Get yourself and your family outside more, and start thinking about how you can bring more of that natural light, that beneficial light, into your indoor spaces.
Absolutely. And most importantly, stay curious. Keep exploring. Keep learning.
Yeah, there's always something new to discover.
There is. And who knows what amazing breakthroughs are just around the corner.
Yeah, that's true. Well, on that note, I think we've reached the end of our deep dive for today.
Thank you for joining us on this exploration of red light therapy and myopia.
Yeah, it's been a fascinating journey.
It has. And remember, knowledge is power. So stay curious, stay informed, and be an advocate for your own eye health and the eye health of your loved ones.
That's great advice. Until next time, keep diving deep.
See you then.
Wow, this red light therapy, it's pretty fascinating stuff.
It is, and we've covered so much ground today.
Yeah, we really have. We went from like the basics of what myopia even is, all the way to this cutting edge research on how red light therapy might be able to help.
And we even touched on, the evolutionary aspects of vision.
Yeah, that was really interesting.
It is, and I think we've given our listeners a lot to think about, especially when it comes to making decisions about their children's eye health.
Absolutely. And that's really the goal, right? To give people the information they need to have those informed conversations with their eye care providers.
Exactly. Knowledge is power, as they say.
Yeah. So before we sign off, is there anything else from the research that you think our listeners should know? Anything we missed?
Let me think. I think we did a pretty thorough job covering the key points. We talked about, those potential benefits of red light therapy, the importance of that choroidal thickness,
Right.
and the need for more research, especially those longer-term studies to really confirm those long-term effects and figure out the best way to use this therapy.
Yeah, yeah. And we also talked about, that interesting idea that myopia might actually have some evolutionary advantages in our modern world.
Right, and the potential downsides of trying to interfere with that natural adaptation process.
Yeah. And we even got into the preventative side of things, talking about, getting outside more and even designing our indoor environments to better support healthy eyes.
Exactly.
So, yeah, I think we covered a lot of ground.
We did, and it's exciting, isn't it? All this research going on, all these possibilities for helping people with myopia.
It is, and I have a feeling we'll be talking about this topic again in future deep dives.
Oh, I'm sure we will. There's so much more to learn, and new discoveries are being made all the time.
Yeah. Well, on that note, I think it's time for us to wrap up this episode of the deep dive.
Thank you for joining us on this exploration of red light therapy and myopia.
It's been a real pleasure.
It has, and remember, knowledge is power. So
Yeah.
stay curious, stay informed, and be an advocate for your own eye health and the eye health of your loved ones.
That's great advice. Until next time, keep diving deep.
See you then.